As the title of our presentation suggests, Alana and I are going to be talking about water, COVID-19, and resilience building. 26 years into democracy, the right to water remains unrealized for many people living in South Africa. And access to water, as we know, emerged early on in the spread of the coronavirus as an integral part of combating it, as frequent hand washing is one of the key preventative measures recommended by the WHO. COVID-19 has starkly illuminated the widespread lack of access to adequate water and sanitation, particularly in informal settlements and rural areas, and how this disproportionately impacts on poor and predominantly Black communities living in South Africa. The virus also raises important questions about how close to home and how easily water is accessible, as social distancing in long queues for water has been difficult. The full extent of the impact of COVID-19 on water services in South Africa is still unfolding. And so we're definitely not going to attempt an exhaustive examination of that relationship. This is a paper that's very much a work in progress. We've done that thing of committing to a conference in the hopes that it would force us to pull our scattered thoughts together. So we really look forward to your help in shaping it. Essentially, what we're doing is building a critique of the Department of Water and Sanitation's response to COVID-19 through the lens of resilience, by firstly examining the ways in which the department's response has built or eroded institutional resilience, and secondly, by starting to assess the impact of emergency water supply on individual resilience, looking both at whether access to water has in fact improved as a result, and also at what is in store for in the context of a transition to a post-COVID world. So the structure of what we're going to be talking about is up on the slide. I'm going to take us through an overview of what the response has looked like, and then we're going to focus both on institutional and individual resilience. Alana and I are going to be tag teaming, so just bear with us as we kind of shift to and fro. So first up, what has the departmental response looked like? As you know, one of the government's first steps in responding to the pandemic was to declare the state of disaster. And the very first set of regulations issued empowered the Minister of Water and Sanitation to issue directions within her mandate. She did on the 15th of April. These COVID water directions established a National Disaster Water Command Center to assist with the rollout of an emergency water and sanitation intervention. Its task was to provide water tanks to vulnerable communities and tankers to fill those tanks. The Command Center was based at and coordinated by Rand Water in return for a management fee. Rand Water was also tasked with emergency procurement done through the Command Center. And so really the regulations effectively centralized emergency procurement and water provision. The choice of tanks as the chosen mechanism was probably driven by a number of different considerations. Some of those may have been that it's much faster and easier to buy a tank than to construct a new reticulated system or to fix an existing one. It was also difficult at the time, particularly during the earlier stages of hard lockdown, to source building materials, as well as plumbing expertise. And arguably, you could also posit that the decision was based on political expediency, at least in part, given the good optics of a tank rolling into town. So the department, through Rand Water, procured water tanks, which are currently owned by DWIS, and it seems that the plan is for those tanks to, in time, be transferred to municipalities post-COVID. Once the tanks were procured, they had to be both delivered and installed. Installation involves building a concrete base and cementing in the tank. Arrangements as to who was responsible for delivery and installation varied from province to province. Sometimes it was Rand Water, sometimes other water boards or municipalities themselves. And then to get the tanks filled, Rand Water have engaged a total of 28 private service providers operating tankers. To give you a sense of scale, by the end of July, 237.5 million Rand had been spent on emergency water supply. So where are we now? A couple of days ago, on the 31st of August, Rand Water demobilized its operations. Its press statement giving the reason, announcing this is quite vague as to the reasons why. It does seem to suggest that it stems from the fact that it was just getting too expensive for the department to continue having Rand Water play this role, given the management fee that I mentioned earlier. We know that by the end of July, Rand Water had been paid 11.3 million as the management fee. What this means effectively is that water tanker service providers contracted by Rand Water ceased all activity a couple of days ago, and filling the tanks now becomes a municipal responsibility. So let's have a look at some of the facts and figures. On the screen is an indication of how spending on emergency water supply has been distributed by province. couple of interesting things to note. You'll see that Gauteng has taken up the lion's share with 35% of spending. Kind of makes sense. It's a large industrial hub, lots of economic activity, and not unexpected. But what is interesting is that the other large economic hub in South Africa is Cape Town. And if you look at the Western Cape, you'll see that only 6.5% of total spending was spent in the Western Cape. We'll leave you to make your own conclusions as to the political differences between Gauteng and the Western Cape. Other interesting things to note, if you look at the Eastern Cape, for example, one would have expected a large focus on spending and emergency support there. The Eastern Cape has the largest backlog in service provision, but they received the smallest amount of funding at only 5%. This next table gives you a sense of how the funds were spent on what different kinds of things the funds were spent. I just want to draw your attention just to the second and third rows there, water tanks and water tankers. So in total thus far, 57.5 roughly million rand has been spent on water tanks, and about double that, just over 100 million on water tankers. That's also where you see the management fee down below when you see implementing agent fee. So that's the fee to Rand Water. This next table represents many, many hours of my life that I'm never going to get back, because what we've tried to do is trawl through press releases issued by the Department of Water and Sanitation, trying to cull the statistics of how many tanks have been provided from those press statements. So what you see on the table is that the first row, the first column of figures are figures provided by the Auditor General. So many of you will know that on the 2nd of September, the Auditor General released a report into COVID spending by the state, and the report does touch on emergency water supply. The figures in the Auditor General's report come from the department itself, and these are the figures that can be verified, right? The figures in the second column are the figures we've put together from departmental press releases. So just a couple of to note. If you look at the orange highlighted blocks, for example, in Gauteng, publicly, the department has claimed to have delivered 2,244 tankers, when in fact it can only verify 1,827. Similar kind of figures in relation to KwaZulu-Natal, with a much higher figure in the press release than in the AG's report. So really what starts to emerge, at least in some provinces, significant over-reporting in media statements. Even more worrying, I think, are the red highlighted blocks. On the 20th of April, the department reported to the Parliamentary Portfolio Committee on its COVID interventions. And in that presentation, it claims 14,737 tanks have been delivered. Now, if you compare that to what the department itself can verify in the Auditor General's report, that figure is just over 6,000, which really leaves us wondering where the other 8,000 tanks have gone. So I'm going to hand over now to Alana, who's going to share some thoughts on the impact of all of this on institutional resilience.
Thanks very much. Good afternoon, everybody. I mean, I think one of the clearest impacts has been a reduction in the amount of financial resources available for municipal services. So for one, there's a reduced municipal revenue. Firstly, I mean, we all know the economic impact of the lockdown has been severe. According to the NIDS-CRAN survey, at least 3 million people lost their jobs, and the GDP is expected to decrease by 5 to 10%. Municipalities heeded the call of both SALGA and civil society to stop disconnections during the lockdown. They received no payment holidays from either Eskom or bulk water services providers such as water boards. In fact, if anything, water boards increased their tariffs to municipalities for bulk water. So the net result is decreased municipal revenue coupled with higher demand due to the lockdown, massive increases in demand and in usage of municipal services. Yes, Treasury set aside about 20 billion in a disaster management fund, a relief fund. We're not entirely sure how much of that support has reached municipalities. So that's the first thing. The other one is that there's been a redirection of the regional bulk infrastructure grant. So by reducing the regional bulk infrastructure grant something like 2/3 and redirecting those resources to emergency supply, essentially what that means is that most of the resources available to refurbish wastewater treatment plants and other essential infrastructure has now been redirected, which is potentially catastrophic from an environmental health perspective, but also from a public health perspective. I think combined with the 31 billion lost to irregular and wasteful expenditure over a 10-year period by the Department of Water and Sanitation, I think where this also leaves municipalities and national government is with no other option to seek very expensive loan finance in order to refurbish bulk infrastructure. We know that in many countries what this has done is contribute to policy capture and to crippling debt. So there's, so it's very, very worrying. Again, the emergency water provision has been, in fact, as Anel pointed out, municipalities have been in a position where they are placed with no option but to operationalize the nationally driven emergency plan. So it's a highly centralized, ministerial-led, politically high-profile kind of emergency measures have been put in place. But, the argument was that given the state of municipal systems, it would have been essential to centralize emergency provision. The question is, what if it has been done to strengthen local government institutionally? Local government ultimately is the sphere of government, the constitutional mandate to ensure water services provision, and that some of these emergency measures have denuded them of the financial capacity to take up that role post-COVID. And also Lisa's point around the water, in the Auditor General's report on the inequitable allocation of water tanks to different provinces. I don't think that it's accidental that there are party political differences across those provinces. So that and then lastly, accountability, very, very poor accountability. The Acting Director General of the department in April spoke about an app that had been developed internally and was going to be used to monitor tanks and tankers. But in reality, and it was promised that on a daily basis, the department would update all the relevant stakeholders on progress. Where do we find any information about tanks and tankers that have been delivered? Really, essentially, either on the minister's Twitter feed or in press releases. There's been some information in the Parliamentary Portfolio Committee meeting minutes, and as we said, a massive discrepancy between what's been reported and what seems to be the case. Here in August is the quote from the Auditor General. He says really very clearly that the department was not, in fact, able to provide a reliable list of the water tanks delivered or their location, making it difficult to audit, questioning the controls that were placed by the department and the reliability of the reporting. So those are some of the issues that we see clearly emerging. Back to Lisa.
So the last issue impacting on institutional resilience that we wanted to flag was about vulnerability to corruption. No one doubts that emergency procurement was necessary, and it's likely that most people would also be comfortable with the fact that the hoops you have to jump through to procure goods and services during a time of crisis need not be as stringent as they are in the ordinary course. That still doesn't negate the need for some level of checks and balances. National Treasury has issued a series of instructions on how emergency procurement should be managed during COVID, and it does seem that at the beginning of lockdown, the Department of Water and Sanitation made some attempts to put safeguards in place. For example, regulations passed by Minister Sisulu confirm that emergency procurement is still subject to the Public Finance Management Act and the Municipal Finance Management Act, and a departmental notice from April indicates that a national procurement officer must be appointed to preside over all emergency procurement, and importantly, the details of all of those transactions need to be made public immediately after the end of lockdown. But in the rather polite words of the Auditor General, there was no evidence that adherence to these instruction notes had been diligently monitored. And so the allegations of abuse of emergency procurement have started to surface. Perhaps most famously, in May, City Press reported on an audio recording in which the provision of emergency relief in the Maluti-Apafung municipality captures Tamika Plaiki, who's no less than the chairperson of the Ministerial Water Services Advisory Group, as saying, "We can all share the slice because it's a lot." See? There's also been some more benign non-compliance with checks and balances. So, for example, Rand Water did not always comply with the required procurement processes to appoint suppliers for water tanks and tankering services. The Auditor General indicates that one of the problems there was that the required signed declaration of conflict of interest forms were not always received by Rand Water. Significantly, the COVID-driven emergency procurement took place in a water sector trying desperately to recover from years of corruption under Minister Mokonyane and reeling from some quite dramatic suspensions linked to ongoing investigations into financial irregularities in several water boards, including Amatola, Lepelle, and Sedibeng. This is important because several of those same water boards were involved in emergency procurement during COVID. Minister Sisulu, as we know, has instigated a large cleanup operation, and so far almost 100 officials have been found guilty of irregular and wasteful expenditure. So basically what we've got is a situation where implementing emergency procurement measures was necessary as part of this COVID-19 response, but given the pre-existing vulnerabilities in the department and many water boards, emergency procurement was always going to be very risky. The other point to make is that water tanks themselves are particularly susceptible to corruption because they are very small, neat, movable assets and therefore easier to lose track of. And we refer back to the 8,000 missing tanks that seem to have fallen off the back of a truck somewhere. So much for institutional resilience. We're now going to turn to the department's response and how that has impacted on individual resilience. So the first obvious question to ask there is, has access to water actually improved as a result of this intervention? Well, for starters, as is hopefully clear by now, it's very difficult to make an assessment given the absence of reliable data or even of any data at all. We do know that the department is currently in the process of conducting a verification exercise to establish what tanks were delivered, and that's due to have been completed at the end of August. But it's worrying that they have to do a retrospective, ex post facto verification exercise of that. That information hasn't been easily available, and that it took an investigation by the Auditor General to trigger that verification process. In addition, the extent of emergency water provision is being contested by civil society. At the beginning of the national lockdown, several civil society organizations launched the Socio-Economic initiative, which is designed to give voice to informal settlement residents themselves who are faced with severe basic services shortages during the pandemic. Socio-Economic publishes weekly information regarding to access to water, clean toilets, and refuse removal, based on responses to a set list of questions completed by residents. A full comparative analysis of government claims as compared to the information coming out of informal settlements is yet to be done. There's definitely a clear need for the establishment of a credible evidence baseline. The information coming from Socio-Economic is useful, but incomplete, as their model uses information from only a handful of settlements to extrapolate to the whole country. The bigger question is why government itself is not generating reliable, publicly accessible monitoring data. So what does that mean for the right to water? How does the transition to a post-COVID world impact on the realization of that right? Well, we do know that debates about data aside, more people in South Africa now have better access to water than they did before, despite what we might argue are the flaws in the emergency response. This raises important questions about sustainability. Given the constitutional obligation to progressively realize the right to water, once the pandemic ends, can the state cease the additional water supply that it has been providing? Doing so may constitute an interference with existing access to water and may therefore run counter to the state's obligation to progressively realize Section 27. We do know that the courts have in the past declared the disconnection of a pre-existing water supply to be a breach of the environmental right. Nevertheless, it may also be that where the service is cut off after the pandemic, the court could consider that the cessation of that supply to be reasonable. This is particularly the case if the supply doesn't meet the minimum standards for basic water supply. You'll recall that those standards include the provision of 25 litres per person per day within 100 metres of where people live, and it's quite likely that a single tank for an entire village will fall short of those standards. So we don't want to be asking the state to continue to provide unconstitutional services. But of course, the counter to that is that tanks are always an emergency measure, and we must move towards a sustainable reticulated supply. But as we've said, we've denuded the financial resources in order to make that possible. So where does that leave us? In our remaining few minutes, I see your prompt, Melanie. I'll hand over to Alana to answer what is the most difficult question of all.
Thanks, Lisa. I mean, I think and it's a global challenge, is how do we ensure that a high visibility humanitarian response to COVID, whether that's in health or in housing or in water, doesn't swamp a systems response, right? And this was flagged quite early on. So in April, SALGA was already saying to a cognitive parliamentary portfolio committee to continue this program over many months will divert limited funding, which is necessary for the provision of reliable and sustainable solutions. Once the funding dries up, once the emergency funding dries up, essentially given municipal constraints, so will tanks. The tanks will also dry up, and so there's an urgent need to move rapidly, exit the emergency response, and move into the next phase of the program, which is to shift to sustainable solutions, and a program of support to water services authorities to provide water services, both technical and financial support. Fortunately, I mean, we'll come back to this in a moment, but there's been decades of technical and financial support to municipalities to provide sustainable water services. This raises some important questions around what the human right to water might look like post-COVID. There is a reason that emergency tanks are not part of our water supply system. They provide a small amount of questionable quality, reliable water at great expense at a shared water point, which is essentially an exceptionally low level of service that's both logistically difficult and prohibitively expensive to run. The running costs of tanks are estimated currently at 100 billion a month. Okay. So those are that's not in the Auditor General's report, because the audit was of WIS's resources and what has been spent by the department. So the department's plan was always, and I mean this was in the acting DP mentioned this in April, to tap into what exists, including return flows, because that's essentially where a lot of our water is lost, factors in return flows, and fix what's broken. This didn't materialize, and this is illustrated as well here by one of the plans to provide water with standpipes at a distance so people didn't have to stand in queues. So moving on to this big question, municipal services, right? It's the elephant in the room, and I think it's been alluded to earlier as well. We're failing long before COVID-19. 90% of municipalities more get qualified audits, they underspend grants intended for basic services. 40 to 60% of the water that municipalities provide is just simply unaccounted for. Coverage levels have been slipping over the last decades. There's weak consumer accountability, needed financial and technical skills, massive amounts of provincial administration, often on multiple occasions. We spoke about Makanda, but earlier, courts stepping in to dissolve councils because they're not fulfilling their constitutional obligations. And despite significant pressure, COGTA is simply not intervening when municipalities are placed under provincial administration. These interventions overall are failing to improve municipal services delivery in any way. So, I mean, not to depress you, but the reality is that the local government system really is failing, and COVID-19 is simply exacerbating this. And it's easy to blame COVID, but that simply exacerbates an existing problem. And water is essential to life. So where water services are inadequate, we know people self-connect to available water supply, whether that's from a nearby surface or groundwater source or to existing water infrastructure. And at SERI, in our research and litigation work, we find a huge range of different examples of self-supply. From the Harrismith Water Heroes, which really is, some of you may know, it's just an unlikely alliance of a shop owner, a farmer, and a community leader who've bandied together to undertake municipal maintenance in Maluti Upper Fong, and have gone to the extent of suggesting that the municipality defray the expenses and their debt to the Maluti Water Heroes by allowing them to collect municipal rates in the Maluti Upper Fong area. To scores of informal settlement residents who dig their own pit latrines so they don't have to risk their lives in order to use public latrines on the edges of their settlements at night with no power. To township residents and inner city occupiers who make unauthorized electricity connections so that they can run spas and stalls in order to eke out a livelihood, which was touched on the informal trade presentation. But self-supply is complex. Unplanned connections, we know, have all kinds of consequences. They reduce the lifespan of both the water source and water infrastructure. They reduce reduce water pressure. This affects other water users. Collecting water from unprotected sources is risky in terms of water quality. And self-supply without kind of regulation means that high-value users will have better access. This is the way this works. Without regulatory controls, the more connected, wealthier, more able or influential you are, the better your access will be. Self-supply also places providers at risk because certainly to municipal systems, self-supply is unlawful. In fact, it's criminalized. It would, however, be difficult for local authorities to prosecute providers, given that water is essential to life, and that the reality is that the choices are likely to be self-supply or no supply. And in fact, interfering with self-supply could constitute a failure to protect or respect the human right to water. So it's complex terrain. I'm not necessarily promoting self-supply, but I am asking the question, as you know, around how we have been stuck for X number of years, right? As long as, for many, many years, as long as we imagine a world in which the municipal turnaround strategy is possible, and note it hasn't been possible despite the COGTA Back to Basics program, hundreds of millions being spent on municipal capacity building and in grants from national to the local sphere. That as long as we continue to believe this, or as long as communities continue to believe this is possible, and that if we continue to knock, the door will be open, do we not just remain dependent on the vicissitudes of a failing service? And what are the health and environmental implications of that? So this question, and this is my last slide, we say repeatedly COVID. If I've ever heard a sentence said more in the last 5 months, it is that COVID has laid bare the fault lines. Well, the municipal system is the fault line that has been laid bare with respect to water. So how does the right to water look post COVID-19? Are we still talking about the state fulfilling the right to water through municipal provision, or are we rather talking about the state protecting and respecting the rights of users to organize themselves? Should the state not just be protecting, what should the state rather not just be offering monitoring support and subsidies to municipalities, to users in accessing water and supporting them in their self-supply? So really, the kind of burning question at the end of this is really, what now is the role of the state in protecting, fulfilling, and respecting our right to water? So those are taken together, a bunch of different thoughts from different views. I'm going to hand over to Lisa to conclude the session, and then we'll close.
I know we're out of time, so yep. So, and we finished.